Welcome to another conversation curated by the Observer Research Foundation. We're still in the midst of a nationwide lockdown that's had a profound impact on mental health at the individual and collective level. In context of this pandemic, it's especially important to now talk about the status of mental health care services in India and how that stands to be shaped or affected by the lockdown and social distancing measures being normalized. So to help sort of shed some light on some of these questions, we have Dr. Sukanya Srinivas with us. She's a counselor and family therapist with over 19 years of experience, and she's had her private practice for the last 9 years. So I'm really happy to have you for this conversation with us, Sukanya. Thank you so much for joining us.
Yeah. Just a correction though, I'm not a doctor, I'm a psychologist.
Psychologist, yeah. So I would just like to start from the outset, asking you, in your experience of sort of providing therapy in context of lockdown, what is some of the changes you think the therapeutic process is going to have because of the lockdown or the social distancing? Is it going to change the therapeutic relationship in any way?
Hi Prithvi, I'm happy to be here with all of you. I don't think it'll change the therapeutic process as such, but I think the way we deliver the therapy, that's what's going to change.
Yeah.
So I think in times of social distancing, it's the very antithesis of what we tell our clients to do in terms of fostering social connection, right? So basically, we need to help them to deal with the loss of that connection with the community and the loss of lives as we know it. So basically, we need to help them with coping with that loss. And in terms of therapeutic process, I think it's more of psychological first aid rather than the typical therapeutic process that we generally follow.
Right.
So, and also being cognizant of how a pandemic like this can bring on other major mental health issues like PTSD later on.
Right.
Like for instance, 9/11, people are still experiencing PTSD in the US. So being cognizant about all those issues that might come up because of a pandemic of this magnitude.
Yeah, I guess just for our viewers who might not know, what's the exact difference between psychological first aid and therapy? So, when you say that we're going to shift towards first aid, what does that exactly entail?
Yeah, so psychological first aid means helping normalizing and validating whatever emotions they're going through right now.
Right.
And it's more emotionally focused and problem solving approach. And maybe therapy will be more directive. So generally therapy is not directive, it's generally non-directive and more insight oriented in normal circumstances. But in this case, we have to mitigate the problems that come up on a day-to-day basis with them, right? So there's no really time for them to reflect and introspect, etc., because it's a time of crisis. So crisis counseling differs a little bit depending on that.
Right. So you spoke about the changes to therapy is going to be more in terms of method. What is something that you think a therapist should be wary of or keep in mind while providing psychological counseling from a distance? Something that's especially going to be important to keep in mind for them.
Yes. I think a lot of therapists are finding it challenging to transition from in-person therapy to online mode of therapy, whether it's through Skype or Zoom or just phone call. So the first thing I think is to rule out, to take care of any technical snafus that may happen. So your internet speed has to be very good so that there's no lag in audio or video. And in physical spaces, we take care to provide a very comfortable space so that the therapeutic relationship and the rapport building is easy. So also on an online platform, one needs to ensure that the setup, the background is unobtrusive, and it ensures privacy to the client. I think that is very important. And like I said, in terms of technical glitches, if you're doing this for the first time, then I would suggest have a test call with a friend or a family member to check out the lighting, the camera angle, etc. So that, if there are any issues, you don't need to do it during the session.
Right.
Also, because of internet speed varying and all that, there are times when a video session may not be possible or the video is freezing. So you need to have a backup plan beforehand, which you need to discuss with the client so that the transition happens smoothly. That if the video stops, we might be shifting to only audio or only a phone call session. So all that needs to be ironed out. Yeah.
Right. And now, I guess from the other standpoint, what should the client, especially now with, online, anyone can sort of claimed that, we provide therapy, and how does the client know for themselves that this is legitimate psychological care, this is someone taking advantage of the, anxiety associated with the pandemic? I mean, so do you feel like, how can clients ensure from their end that they are seeking the right kind of care?
I think they have to ask for the credentials of the therapist and not just go and run with what the therapists say. I think they have to ask for credentials, ask for proof of degree, right? Of course, we don't have any licensing in India, so that's not something that we can ask for. So I think we can inquire and ask for the LinkedIn profile to look up about their credibility and credentials. That's right. One thing to do. Also, one more important thing is, in online session, it's very difficult to intuit emotional states just by, because we miss out the body language. Vital visual cues are missed during online sessions. So we have to work harder. So generally, it's much more exhausting to do online sessions than in-person sessions, because you have to pay a lot of attention. Right. Because let's say a fidgeting of a leg or what they're doing with their hands is something that you might not notice. Right. on online session. And if it's audio, then it's virtually impossible. So we have to focus on inflections of tone, inflections of voices, and ask them questions based on that. So that also, I think, because we don't have a physical space, it doesn't enable that process.
Right. Something that I have seen, especially with the pandemic, is that mental health care or concerns has become a very universal sort of fear, irrespective of socioeconomic background.
True.
With this in mind, how do you think India could sort of democratize mental health services, in such a time, especially now that people from all walks of life are sort of expressing concerns related to mental health? So how can the community and there be a sense of like democratizing these services?
Yeah. I think democratization is the only way forward. So I think we have to integrate mental health services into already existing community and primary healthcare services at district levels, etc. So if you take case in point being Kerala, which has done a fabulous job, because after the Nipah and the 2018 floods, they've set up a very good district level mental health program. So they've appointed a counselor for every panchayat and pay on a contract basis for a year. And so they already have everything in place, you see. So, and there is a lot of integration between, the community health services and the existing public health services. So I think that is definitely the way forward. If you've heard of a innovation called Friendship Bench, which started in Harare, Zimbabwe, many years back. So what they've done is they've trained lay counselors and called them community grandmothers, and equip and train them with basic CBT. So they place a bench outside the clinic, and it's called a friendship bench. So it's very non-threatening, and people are willing to come and talk to these grandmothers. And of course, that has to be supervised. They're trained people, and it has to be supervised by a mental health professional. So friendship bench is one such initiative. And I think Sangat in Goa is doing something like that. And Anjali in Kolkata is doing something like that. They're training lay counselors and providing them with all the resources.
Right.
So that is definitely the step forward.
So the key is to sort of integrate the, you could say that the community itself to like disseminate care rather than, just always expecting a very specific, because we're already suffering from acute shortages of mental health care personnel. So,
yes.
Okay.
Yeah, so NIMHANS is also doing something like that. In fact, I had the privilege of working with NIMHANS on some such project in 2016. So right. The Center for Public Health and the Department of Epidemiology rolled out something called Yuva Spandana program. So it was supported by the Ministry of Youth Empowerment and Sports, and they picked up people from the community, youngsters from the community, and we trained them in. So there were a group of us who they said from the expert panel. So we developed the modules, and the modules were translated into Kannada, and NIMHANS trained these lay workers and lay youth to provide support services, psychosocial interventions at the panchayat level. So they rolled it out in about 20 districts now, and I think it's still running and expanded to more number of districts. So definitely democratizing is the way forward.
Right. So yeah, the answers essentially looking through the community, and also something that you mentioned, which was very interesting, was language, like making sure that it's all sort of contextual to the locality, especially in India.
Yeah, socially and contextually, the structure has to be very carefully designed.
Right.
Yeah.
Another question, because we both can agree that democratizing mental health services in a country like India is a tall order. It's a very ambitious task.
True.
But in your experience, especially since the pandemic, is there a section of the Indian population you have found especially vulnerable, more so than others? A sort of special, especially a group that you have found to be, extra precautions must be taken because they're in a precarious spot mental health wise? Or you felt it's all of even across the board?
I don't think it's even. I think migrant workers, daily wage earners are the most vulnerable. Frontline responders like doctors, nurses, etc. are very, very vulnerable. And as you've been reading, they are also, facing stigma and ostracization by communities. Let's say senior citizens already feel very lonely and isolated and helpless. So I think this puts them more in that kind of environment. Single women and women who are exposed to intimate partner violence and domestic violence, etc. So in that context, I would like to add that I just read a few days back that the Orissa police is calling every house that had registered a domestic violence complaint. Right. And they're calling them back to find out whether everything is okay. So we need, initiatives like this to reach the most vulnerable part of India. Because even with the migrant workers, there's a language problem. So the government has set up helplines everywhere, but availability doesn't necessarily translate to accessibility. Right. So how do we access these groups of migrant workers everywhere? We need to come up with innovative ideas for that.
That is right.
Yeah.
And also the fact that many of the people that you mentioned who are especially vulnerable may not have the same access or privilege to seek therapy the way we know it.
And many of them can't even call from their homes. They can't even call. Yeah.
Right.
Yeah.
Right. I would like to pose, I think we might be short on time, so I'd like to pose one last question for you. That Aisha Malik, who sort of works for the WHO's Mental Health and Substance Abuse Department, spoke about how we have to integrate mental health care as part of the public health response. And you mentioned it at the start.
Yes.
How do you think that would work in a country like India with a pre-existing stigma for seeking care? And especially now with, as you've established, the need is very sort of dire to seek care. How do you sort of battle this like pre-existing stigma that's existed even before the pandemic hit?
So if you see other models which have been successful, like let's say Kenya did something like training they train their healers, their faith healers and the local healers and the local doctors in it. So I think choosing people from the community and training them and then rolling it forward would help, because they understand the community better. So I think, and also what about public like radio advertisements or film actors coming out openly and saying that it's okay to seek help? I think all that would help a lot. People who have influence, social influence, I think need to tap on that, because it needs all the stakeholders to come together for this to really take it forward. And as you already know, the number of psychiatrists available and psychologists available is dismal in India.
Dismal, yeah.
Yeah.
That is very true. And I think there's just one last question, which is about the way forward, because it would sort of be incomplete to just leave this conversation here. With sort of social distancing normalizing, we can all agree that it's not something that's just going to leave or end anytime soon.
Yes.
If you had to make a prediction or a foresight into the next 5 years as to therapy or psychological care, what is the one thing that you fear as a psychologist that may impede your ability to provide care, or the community's ability to provide care, because of anxieties associated with the pandemic and the general sort of fear of trust or trusting people? Do you fear that sort of affecting care in India?
I think it depends on how the government tackles this going forward. You're talking about the stigma of people who have already been, diagnosed and all this. Is that what you're talking about?
Yeah.
And the stigma of seeking psychological help.
After coming out of it, exactly, because they will be vulnerable to that. Yeah.
I think in the urban crowd, that's not a problem. The only in the urban milieu, I don't think that's a problem. But I think in the rural, semi-urban and rural places are where it's going to be a problem. That's why I said using people from the community who they already trust. is what we need to do. And if you and I go there, it's going to take time to build that trust with them. So we need people from the community already who we choose and train and develop. That's what we need.
Right.
Yeah.
Okay. Thank you so much for taking the time out to speak with us. And I think this is a really important, pertinent conversation to have. So thank you so much, Sukanya, for taking the time.
Thank you for having me, Prithvi.
Yeah, of course.
Yeah. Bye.